Okay, so such an amazing presentation before me. I'm not sure if I'll be able to ever match that up with the amazing visuals, but this is a very, so we're at a very early stages, me and my co-authors here in this research to understand the social vulnerability in indices, which is very similar to the idea of community vulnerability assessments and other indices and tools that are used to sort of sociologically understand what's going on with different communities and how they are put in different sort of systematic disadvantages. So we are not the weather extreme events experts. We are just sociology students, public policy students. We do have our advisors as Dr. Shah and Dr. Fernando Torres Aponte and Olga with us to guide us on understanding what social vulnerability would mean in hazards and disasters context. So our research, which is at the stage of finding data as of now, and we hope to report results by the end of this year. Is sort of a systematic review, which is a literature review where we methodologically identify, screen, and select a comprehensive research on a topic, on a research question. So essentially, our data are the research articles that we are going to extract from different databases to understand what the extant literature tells us about the SVIs. And so we have the research question, which actually ties in this concept or the tool of SVI within the hazard and disasters context. We're going to look at both academic and gray literature being the non-academic side of things, where we would look at government reports, especially CDC uses its own SVI at a very large length, and other government agencies also use the CDC index. So we're going to look at that, and not only look at that, but also critically evaluate it. So one thing I should have prefaced with is since we are at the sort of the initial stages of our research, it would be really beneficial for us to sort of have your input, your questions, and your feedback so that we can improve this topic, but also explore new avenues that we may be missing. But our objective with this topic or with this kind of preliminary research is to understand what kind of strengths and shortcomings do these models provide us, and how they're utilized in public policy decisions, especially when it comes to extreme weather events, and what's missing. So how can we develop, say, our next generation indices, or even do away with indices, come up with something else, something more, probably qualitative as well, to that understands and that appreciates people's perceptions and lived experiences, which depend on their social identities and physical locations. So one of the efforts that we would like to take, and that could be another research project altogether, with this being a foundational research project, is to incorporate what the indigenous and Black feminist scholars have been talking about since the beginning of their times, that we need this anti-racist, intersectional, decolonizing mechanisms to understand things that we have been so far understanding in a very technocratic and at times even white supremacist ways. So the fight is against these biases that may have been reproduced in what we already have as these in these indices, in these tools that we study vulnerability with. I'm not going to go through these key concepts, which you all are experts at a great length. But yeah, our focus is again using these indices in the context of natural hazards, and by natural hazards and also social ecological hazards, because we understand that it is us human beings who are sort of wreaking havoc in this world. And the combination of anthropogenic and natural changes is what's causing the climate change that we see today. But we also want to step back and see the policies that we have made in past. And I would say the racist policies of redlining, what has led to mass incarceration, say wealth inequality, all of these also affect the life chances of people. So it's the compounding effects of all of these actions, conscious and indirect, that have led to where we are today, where some communities are at the front lines of natural hazards, of climate disasters. Um, so for us, the two key concepts again are the collection of these natural hazards and weather related events, but also what do the extant literature does the extant literature mean by social vulnerability, and how they turn them into a tool to understand, to evaluate a community's or a person's vulnerability. And we appreciate that vulnerability is not just a single event. It's a host of not only events, but the circumstances the people are put in, the conditions the people have been in. And so when we talk about things like risk, resilience, resources, and even things like emergency resource allocation, that has been very socio-politically driven. We have seen in research that some communities are able to, not only because of their location, but also the political power that they enjoy, or the political clout that they have, they're able to secure more resources even after disaster. So these compounding effects, we want to see how much they have been reported in these indices, and how actively they have been incorporated in the indices. And so far we know that the two foundational pieces on these indices, which is the Qatar and colleagues' work on understanding these indices, and the CDC have some gaps in them. So they do have this appreciation for the fact that social vulnerability is not not only somebody's gender, race, or ethnic identity, but also where the communities that they live in. So the density in the urban areas, the unemployment rate, or kind of resources that community has, fire stations, the level of food deserts in these communities is also affecting their social vulnerability. But we also want to see that if there are any ways in which historical processes, say redlining, the health disparities that we see throughout the history of the United States among different groups of people, are they salient, and how can they be incorporated in our studies of the indices? And so our work is driven through these theoretical frameworks, which are also informed by a sociological understanding of how to look at it. Intersectionality, which is interrelated and also overlapping social identities of people, are important, because a struggle of, say, a Hispanic woman may look different from that of an Asian man. So we need to understand that how these social positions are making some groups of people, putting some groups of people in more disadvantage than others. What's also important is that in traditional research, we have ignored to a large extent the knowledges that are derived from these communities, the practices of these communities, and they can be very important, because we come from sort of an armchair research point of view, but these people have been living, these are the lived experiences of the people who are there. So they become experts, and that's why we encourage participatory learning, where we learn from these communities. So rather than us imposing certain research topics or certain ways to do things, we learn from these communities and sort of co-create solutions specific to the communities. And is that happening? And is there a room for that to happen in social vulnerability indices, or understanding of vulnerability is something that we're looking at? Our anti-racist perspective also talks about the idea that does resilience mean that we weatherproof a neighborhood, we weatherproof households, or is it more than that? Is it about acknowledgement of the racist policies that were backed by, say, federal agencies and other governments in the past, and they still resonate in the system that we live in today. So these fundamental causes of this disenfranchisement are the things that we are looking at and seeing if they have been somehow systematically reported and understood in these indices. So that's basically where we are at in our goal for this research. But I do want to go to our research design really quickly and let you know how we are looking at it. And again, this is where we would definitely benefit from your feedback as well. But the two concepts, as I mentioned earlier, are the index itself, social vulnerability index. So that would be one of our terms, one of our key terms in searching for our data, which is the articles, which are the articles from academic and gray literature. And then we have this length of string of keywords that we are going to put in to see how social vulnerability is used in this natural hazards and disaster context, because it's also used in other contexts, in other public emergency contexts like teenage pregnancy and in other ways that we're not looking at. We are focusing on hazards and disasters. So that would be our search criteria. Some databases that we are going to look at are some general databases, but also the specific ones that derive literature from sociology, public policy, environmental sciences, geography, and so on and so forth. And then one of the key components of our research is to understand how CDC's SVI informs public policy, and that's why we're looking at CDC from gray literature and other government documents. The first, after collecting this large sample or large data size, we are going to screen out the ones that we want to actively look at. So there is this is a criteria that we have in order to screen our research to a manageable number, but also the articles that would be relevant to us. As of now, this is a great limitation that we are going to look at the academic and gray literature articles published in English language, but we hope to look at, in the next phase, look at other articles, especially in Spanish. We have established that year 2000 is going to be a good timeline for us, because 2003 was the time when Cutter and colleagues came up with their formative work on social vulnerability. So that understandably is a good timeline. And then how this idea of vulnerability index is conceptualized. Again, we are not looking at other health outcomes, say social vulnerability and teenage pregnancy, but we're looking at it through the hazards and disasters context. And then in our full text review, we are going to extensively examine as to how these two ideas have been used in conjugation. And so this is essentially our goal. We have a whole set of questions, but I have gleaned some of them here, some of the important ones here as to why we're looking at these articles. These are the questions that we're gonna actively ask when we are going to be reading these articles, when we are going to be fully reviewing these articles so that we can critically evaluate them and see which ones have more strength and which still have limitation and still need some more comprehensive understanding of vulnerability. So for example, we are looking at the theoretical frameworks that the authors may have used. How do they define vulnerability to begin with? Are they similar with other work of other authors and other agencies? And do they use the ideas of these compounding effects of racism, systemic racism, of patriarchy, the wealth inequality that we see in our society, the kind of disadvantaged and disenfranchised neighborhoods people are placed in. And if they use that, or if they do not, what kind of mapping do they do? We saw that one way to map vulnerabilities through counties or through census tracts. But would it be also beneficial to redefine communities in a different way? Redefine social boundaries, and can we define social boundaries in certain ways? And then again, an important question would be also to understand how political power or politics also influence understanding of somebody's vulnerability and access to resources. And that would also beget the question that what does it mean to sort of have to sort of instill resilience in a community? Does it come from within, or is it something that we come up with? And is resilience enough? Should we move beyond that? Should we move beyond just fixing the neighborhoods, fixing the households, providing the resources, the recognition of deprivation that we have put certain communities in? How can that be corrected more holistically? So essentially, that's our work so far. And those are our hopes with this work so far. But I would definitely love to see how we can improve with some feedback from you. Thank you.